The information and or answers provided during Lupus in Color videos and live events are for educational purposes only. They are not meant to be used as a substitute for professional medical advice. The information contained in any video or live event is not intended to recommend the self-management of health problems or wellness. It is not intended to endorse or recommend any particular type of medical treatment. Should any attendee have any healthcare related questions, promptly call or consult your physician or healthcare provider. Persons accessing this information assume full responsibility for the use of the information and understand and agree that Lupus in Color or its presenters are not responsible or liable for any claim, loss, or damage arising from the use of the information.
Hi, I'm Dr. Maggie Cadet. I am a New York City rheumatologist. I am a specialist who is focused on diagnosing and treating disorders related to the immune system like lupus as well as arthritis. May is National Lupus Awareness Month, and I'm here to talk to you about different areas in which lupus does affect an individual and how lupus patients can live with this disease and what treatments are available and complications associated with lupus. Lupus is an autoimmune disease. This is a disease in which there are proteins or autoantibodies which recognize your own organs as foreign and may attack the organs. In lupus, any organ can be attacked. There are multiple organs that are affected, and this can include the skin, the brain, kidneys, lungs, heart, joints, as well as your blood system. Now, one of the major complications of lupus is heart disease, and we can get into that more afterwards. What happens is patients with lupus have an increased risk of heart disease and early atherosclerosis or plaque formation. Now, this could be due to a variety of reasons. Having the disease lupus can increase your risk, like having diabetes. There are also other risk factors that are really important in lupus patients, like high blood pressure, high cholesterol, and these can be seen in other diseases like diabetes. But again, lupus patients are at risk for these diseases. Also, lupus patients are on chronic steroids, and steroids can also increase blood pressure as well as obesity and other risk factors related to heart disease. So it's extremely important that anyone diagnosed with lupus does seek a cardiologist and gets evaluated. It might need an EKG, an echocardiogram, and assessment of risk factors such as weight, blood pressure, cholesterol, good and bad cholesterol, as well as triglycerides. What signs and symptoms should you look for when thinking about complications of lupus? A lot of patients do complain of extreme fatigue to the point where they feel like they have the flu all the time. They can't perform daily tasks like brushing their teeth, combing their hair, or even simply walking. So if this goes on for a prolonged period, you should definitely alert your doctor. For kidney disease, patients may complain of a frothy urine or bubbly urine, or sometimes detect a discoloration of urine, which may indicate blood. So, or, peeing or urinating a lot. So that's something that should be brought to the attention of your rheumatologist or internist. Heart disease can manifest itself as many different ways. So the patient may have obviously chest pain or even mild chest pressure. Shortness of breath can be a sign of fluid in the lungs or the heart. As well, again, extreme fatigue, or even symptoms like feeling like you have reflux or heartburn and indigestion. Remember, in women, chest pain or cardiovascular disease symptoms may manifest itself differently than men or other patients. So again, all these symptoms should be brought to the attention of your rheumatologist and examined, especially if they go on longer than a few weeks. Extreme joint pain, swelling, any kind of hand deformities, obviously, are things that you may want to bring up to your rheumatologist. For patients with blood disorders, sometimes easy bruising may be a sign of a low platelet count. Fevers obviously can sometimes manifest itself. as a relation to blood disorders as well. Rashes can sometimes come with a lupus flare, so it could be around the face or the malar area, sparing the nasolabial folds or the folds in between the cheek area and the mouth area. There could be other scarring, discoid lesions or scarring lesions, or other types of skin lesions that may also manifest itself with a lupus flare. But in terms of kidney disease and heart disease, which are major complications of lupus, please look for the chest pain, shortness of breath, frothy urine, blood, or some kind of discoloration in the urine. Individuals living with lupus should be followed up regularly with their rheumatologist or some kind of other specialist, or even an internist. There are blood work that should be done first to detect lupus and also in monitoring different complications. There are autoantibodies or special proteins or lab tests that are specific to lupus. So this could be an anti-nuclear antibody, a double-stranded DNA antibody, a Smith antibody. These are some of the special tests that are usually seen with lupus. There are complements, C3, C4, that are part of the immune system cascade that sometimes go low when there's a lupus flare. Also, your doctor should be checking for a CBC, specifically looking at a white blood cell count for leukopenia or low white blood cell count, maybe low platelets and anemia. Inflammation markers should be checked, so a C-reactive protein or sedimentation rate as well. There are other tests looking at the kidney function, like a BUN or creatinine should be looked at. Urinalysis should be checked as well, looking for blood or protein in the urine, which may indicate nephritis. And other blood tests like liver tests should be also checked because, again, lupus can affect any organ. So if you're living with lupus, please follow up with your physician at least every 2 to 3 months to check for these tests and see if your lupus is active or if you're developing any kind of organ damage. For patients really thinking about their heart, again, a lupus patient should see a cardiologist and have an EKG, have their cholesterol lipids checked. This means the bad cholesterol and the good cholesterol, HDL, triglycerides. They should also have their blood pressure checked at every visit because, again, high blood pressure is a risk factor for heart disease, and some of these patients also may have high blood pressure or some kind of blood pressure abnormality related to their kidney disease. Make sure that a BMI is also checked. This is the body mass index, which may correlate with overweight or obesity measurements. So follow up and constant monitoring is really important for any lupus patient and their physician. It's important that the physician and lupus patient works together to make sure organ complications do not occur. As I mentioned before, cardiovascular disease or heart disease is a major complication of lupus. It is extremely important that patients do help modify their risk factors associated with heart disease. Some risk factors may include high blood pressure, so maintaining a good blood pressure, a good systolic, the top number over the bottom number is extremely important. Usually the goal is less than 130/80, but speak to your physician about your specific individual goals. Cholesterol control is also an important risk factor that should be definitely initiated in someone's regimen living with lupus. This means having a low LDL or bad cholesterol, as well as elevating HDL, good cholesterol, and minimizing the triglyceride levels. This can be accomplished sometimes by medication. Your doctor or cardiologist may introduce a statin or some kind of medication to help with cholesterol if other measures are not working. Obviously, eating well, so a good diet with eating good fats, such as maybe having avocado, having a diet rich in vegetables and fruits, and fish and other good amounts of protein is really important, and minimizing sugar as well as the bad fats is really important. Decrease sugaring drinks, and again, limiting red meat and other foods is really important to helping your cholesterol as well as your blood pressure and eventually your weight. These are all risk factors for heart disease. Movement is extremely important. So the guidelines are engaging in moderate aerobic activity of 150 minutes per week or 75 minutes of vigorous, intense exercise per week. It is important to move. And I understand patients with lupus and arthritis have a difficult time moving because of the systemic inflammation. So even just walking, if you can do it. There are other exercises like swimming, which takes some load off your joints, or yoga, or some type of exercise. But movement is extremely important in reducing your heart risk events and complications. So get moving. Definitely eat well, minimize alcohol intake, and absolutely no smoking. It should be instituted in your regimen in terms of limiting heart risk complications. Patients living with lupus have risk of kidney disease, and it's extremely important in order for these complications not to occur. It is important to get the disease under control. So as soon as you are diagnosed with lupus, please work with your rheumatologist to find the best therapy that can help control your lupus and control the systemic inflammation. There are medications that are like Plaquenil or hydroxychloroquine, which is the mainstay of treatment for a lot of patients with lupus. There are other treatments such as steroids, which may be needed for time to help with the inflammation. Steroids do have side effects like high blood pressure, diabetes, cataracts, depression, and other side effects that may occur. So it's important that you speak with your rheumatologist, but steroids sometimes are needed actually in order to control the inflammation. There are other treatments out there for lupus now. It's so great that there are treatments available. Other steroid-sparing agents like methotrexate may help with joint activity. There is another medication, Imuran or azathioprine, that's usually used, as well as Celsa, possibly for kidney disease. There's also cyclophosphamide, which has been used. There are side effects with this medication as well, and usually should be used cautiously in women of childbearing age because it can affect ovarian function and may lead to premature ovarian failure. Now, there are other medications or biologics like Benlysta or belimumab and Saphnelo, which is also used to help with lupus activity and to hopefully help prevent complications with kidney disease with some of the medications and just lupus complications overall. So make sure you speak with your rheumatologist about your specific medical history, because a lot of these medications can, obviously they do have side effects, and it's important that everyone talks to their rheumatologist about their medical history and decide if this is a medication for you. But it's great to know that there are medications out there right now that are available for lupus nephritis as well as other lupus complications and lupus activities. And there are a lot more drugs on the market ready to help lupus patients. One of the important things in reducing the risk of a lupus flare and complications is managing the disease itself, as well as the other factors which can contribute to a lupus flare. Sometimes sun or UVA, UVB light can trigger a lupus flare. So it's important that patients use sunblock, protective clothing, which has protection against UVA and UVB light, as well as glasses, wide brim hats, obviously staying out of the sun in the hottest part of the day, going for walks maybe late in the day, limiting, again, sun exposure when it's really hot. These are all things that can help reduce a lupus flare due to photosensitivity and sun exposure. Remember that artificial light, like tanning beds, can also cause a lupus flare. Minimizing stress is extremely important because lupus flares are sometimes triggered by stress. So engaging in meditation, whether you're just sitting outside and just taking in the moment and just doing your breathing techniques is really important. Going for a walk, engaging with friends and family, engaging in a hobby, like even if it's playing cards and that's something not too active, is extremely important. Some lupus patients may need a support group as well as a therapist to help minimize the stress. And then again, find support because this is a chronic disease and it can be debilitating. Another thing to try is, again, just movement. Reducing your blood pressure, reducing cholesterol by exercise and movement is extremely important. It gets endorphins going, cortisol levels are improved with exercise, and it does reduce risk of diabetes and hyperglycemia. So again, whether it is moderate activity or just walking, brisk walking, swimming, yoga, movement is extremely important. Finding support, as I mentioned before, is extremely important because I want patients to know that you're not alone. There are people suffering from this disease. Other celebrities like Toni Braxton, Selena Gomez have been very open about their lupus journey. So you are not alone. It's important to find support. And again, eating a healthy diet really does help with reducing risk of heart disease and other lupus complications. Reducing alcohol intake, no smoking at all, because smoking can cause a lupus flare. It can cause triggering of the immune system. So all these factors can help to leading a healthy lifestyle, engage in a hobby, again, stay focused on yourself and disease, limit the stress in your life. Lupus patients, you can do this. There are people behind you to support you. As May comes to a close and Lupus Awareness Month comes to a close, Lupus Warriors, I just want you to know that we are not just behind you for just this month. We are behind you every month of the year. Living with lupus can be very difficult. It is a chronic disease such as diabetes and heart disease. And even though there are risk of complications with organs, you can thrive. You can live a good life. Please work with your rheumatologist and other specialists to keep this disease under control. Please get support from the lupus community, other organizations like the Lupus Foundation, Lupus Research Alliance, Arthritis Foundation, and there's many organizations out there that are willing to help. There are online communities like Lupus in Color and that can really offer a lot of support. Lupus Warriors, I'm wearing my purple today and often to show my support, and I know other people are around here supporting you as well. You are not alone. You guys are fighters. We're with you every step of the way. You will lead a good life and thrive. And don't lose hope. There are medications out there. There are specialists out there to help you. And there are now new medications coming out to help control your disease. You are not invisible. Keep fighting and keep wearing your purple.